Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is September 15, 2025. This video is on a New England Journal of Medicine article published August 38, 2025, titled Targeting APOC3 with Olezarsen in Moderate Hypertriglyceridemia, published in the New England Journal of Medicine. Olezarsen is an N-acetyl galactosamine conjugated antisense oligonucleotide that inhibits APOC3 messenger RNA, reducing triglyceride levels. It targets moderate hypertriglyceridemia in this study, 150 to 499 milligrams per deciliter, in patients with elevated cardiovascular risk. APOC3 plays a pivotal role in limiting triglyceride clearance via inhibition of lipoprotein lipase. Study designed Phase 3 double-blind randomized placebo-controlled trial, the Essence TIMI 73B. Study cohort 1,349 patients with triglyceride levels less than 500 milligrams per deciliter. Median age 64, 40% were female. Stratified by triglyceride level and cardiovascular risk. Intervention, monthly subcutaneous Olezarsen 50 mg or 80 mg versus placebo in a 3:1 ratio within each cohort. Duration 12-month treatment plus 13 weeks safety follow-up. Statistics and ANCOVA with multiple imputation. Primary outcomes, percentage change in triglycerides from baseline at 6 months. What did they find? Triglyceride reduction at 6 months, 58.4% with 50 milligrams and 60.6% with 80 milligrams versus placebo, p-value less than 0.001. Reduction of APOC3, 61.7% with 50 milligrams and 69.8% with 80 milligrams versus placebo. Again, the p-value is less than 0.001. Non-HDL, remnant, cholesterol, VLDL cholesterol and ApoB were also significantly reduced. No change in LDL cholesterol. Serious adverse events similar across groups. Mild injection site reactions more common with Olezarsen. Key takeaways: Olezarsen significantly reduces triglycerides in moderate hypertriglyceridemia. No increase in LDL cholesterol or severe safety signals. Broad lipid lowering effects. May have long-term cardiovascular benefits. Need outcome trials. The study was supported by Ionis Pharmaceuticals. Clinical pearls. APOC3 inhibition is a promising target for lowering triglycerides. 90% of the patients with Olezarsen achieved triglyceride less than 150 milligrams per deciliter at 6 and 12 months. Unlike statins, LDL cholesterol is unaffected, while non-HDL and remnant cholesterol dropped substantially. Mild liver enzyme elevations occurred more frequently but rarely reached clinical significance. No acute pancreatitis observed in the 50 milligrams arm. Contributions: the Essence TIMI 73B trial is by the TIMI study group, known for landmark cardiovascular trials from the Brigham and Women's Hospital in Boston. The senior author of this article is Mark Sabatine, MD, MPH, chair of the TIMI study group. Co-lead authors were Brian Bergmark and Nicholas Marston. Sponsor and developer of the antisense oligonucleotide platforms were Ionis Pharmaceuticals. Olezarsen and Olezarsen are related APOC3 targeting therapies in the same pharmacologic family. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.